This is Dr. Robert Miller, Medical Director at ASCO Cancer Link. On behalf of my co-authors at ASCO Cancer Link, I am pleased to discuss the findings in our abstract, Disproportionate Impact of COVID-19 Disease Among Racial and Ethnic Minorities in the U.S. Cancer Population as seen in CancerLink Discovery data. Next slide. The COVID-19 pandemic has certainly disrupted the U.S. healthcare system at many levels, including the care that is being received by patients with cancer. It has been shown in other studies that COVID-19 disease and poorer outcomes have been higher among certain populations. We were interested in looking at the data from the CancerLink Discovery database, which is a research database derived from ASCO's health technology platform CancerLink, to try to identify COVID-19 risk factors among patients with a cancer diagnosis. Next slide. We first identified patients with cancer who had a positive test for the SARS-CoV-2 virus, either an RT-PCR test or an antibody test, or we looked for a diagnosis code in the electronic health record for COVID-19 disease. We focused on the oncology practices that were subscribing to the CancerLink platform. For comparison, we looked at a baseline cancer population in the same oncology practices. We were particularly interested in studying the degree to which COVID-19 had a differential impact on patients who were members of racial and ethnic minorities. We were also interested in studying some of the other characteristics of these patients with cancer. Next slide. During the period from January 2020 through the end of August 2020, we found a total of 965 patients with cancer who had COVID-19 in the CancerLink practices that we studied. This is to be compared with a total cancer population of nearly 480,000 patients. One of our findings was that patients with cancer who were Hispanic were 5.25 times as likely as non-Hispanic patients to have COVID-19 disease. We also found that patients with cancer who were Black were nearly 1.7 times as likely as white patients to have COVID-19 disease. Next slide, please. We also looked at patients by the type of cancer, and we found that patients who had hematologic cancers or blood cancers, diagnoses such as leukemia, lymphoma, or multiple myeloma, were about 1.4 times as likely to have COVID-19 disease in this population as patients with more common solid tumors such as breast cancer, colon cancer, and lung cancer. We also found that a total of 52 of the 965 patients, or about 5.4% of the patients, died during this period of time. It is important to point out that in our data, we cannot determine a specific cause of death, whether that was due to the COVID-19 disease or to some other cause, including the cancer. We did note that most of the deaths occurred in patients who were age 70 or older. Next slide. In conclusion, we found that patients with cancer who were Hispanic or Black were significantly more likely to develop COVID-19 disease than patients who were non-Hispanic or white, respectively. And this disproportionate impact of race and ethnicity has been shown in non-cancer populations as well in some other studies which have been done. We also note that the higher risk of COVID-19 disease in patients with blood cancers is of particular concern because it's known that these patients already have a greater risk of immunosuppression and a higher risk of infection at baseline. It's important to gather data about people with cancer during this pandemic because it helps us to understand the risks to these different populations and potentially develop mitigation strategies. Finally, all patients with cancer need to take precautions that are known to be effective, such as wearing masks, practicing social distancing, and getting flu shots. But this is particularly important for patients that are part of minority populations. Thank you very much.